The reason I became a clinical educator is because in the past I've gone through a chronic illness. I'm actually still going through the chronic illness. I had nurses that were so good to me that I physically felt better. It made me want to be a better patient because my nurse was helping me. And then when I saw the opportunity for the job at VMS, it was for patients that had the same disease that I had. So I basically got to educate people that are in a place that I used to be in and get them through the really rough times. So being able to educate them, support them, be empathetic, listen, help them find strategies for overcoming barriers that they may be experiencing has been amazing. It's just been amazing.
Physicians' time is limited, and patients are being encouraged these days in the current healthcare setting to take ownership of their own healthcare. And that's what VMS is. It helps patients to be empowered to take ownership of their own healthcare and be successful.
One of my most memorable patient success stories was this gal that was completely terrified to give herself an injection. So much so that she would cry and shake and almost make herself sick before she injected each time. Rather than giving her tough love, I understood, and I let her know that I understood what she was going through and what she was feeling, and I supported where she was. And because of that support, she was eventually able to gather the courage to give herself the injections, and each time she did it, she got enough self-esteem, I guess, or confidence in her own abilities to be able to give this injection that by call 7 in our series, she was completely independent in this and was thrilled at my presence on the phone that I was able to give her that support. And she even said, "I'm so glad that you didn't say suck it up," because that is what I have heard time and time again when I said, "I'm afraid to give my injections, I can't do this." She literally had a healthcare provider tell her to suck it up. And she said that the fact that I was warm and gentle and encouraging helped her get through that process.
The reason I wanted to work for VMS is that the foundation of the company is patient empowerment. I've been a patient. I know how much patients need to be empowered. I know that I went through a really long period where I didn't have support. I didn't have the ability to navigate the whole process of healthcare. I felt alone and isolated, and this company puts its patients first. It's the first thing that we do in everything. Any project, anything that we work on, we think about the patient perspective. What does the patient need? And that's why I went to nursing school. I want to help patients. So having the opportunity to work for VMS and to be able to do that on a daily basis, I can't even explain how fortunate I feel to work here. And that
when a patient can say to me, "Thank you for listening, thank you for hearing me out, thank you for helping me with this problem I'm having, helping me find solutions."
I would have to say my secret sauce in education is to be a good listener. You cannot just start out of the gate thinking that you know what that patient's needs are. You have to listen. What are they telling you? And once you hear what they're telling you, you can then identify what their needs are and meet them where they are.
So what I feel like is the secret sauce to being a clinical educator is meeting the patient where they are. You want to find out where they are along their healthcare journey, and when you can find out where they are, you can tailor the training or the education or the emotional support, whatever it is they need at that time, to meet them where they are. And if you can do that, that has the biggest or greatest impact.
Every time I know that I'm affecting somebody's life, it gives me energy. It gives me almost a high, if you will, to reach that next patient and seek out their need and how can I fill that need.
I get to help people that have walked my path. I went through a lot of struggle and a lot of pain. I felt alone, isolated, apathetic, tired, and now I get to help those same people get through what I went through, and I get to make a difference. And I went to nursing school because I wanted to make a difference. I wanted to put good into the world. And the fact that all the struggles that I went through led me on this path to where I can help someone that's been on the same path that I've been on is amazing. I get to help people who have Crohn's disease and ulcerative colitis or autoimmune disease. I know the struggle. I know how hard it is. And to know that my job is to really make a difference in somebody else's life is amazing. It really is. I can't even explain it. So sorry, I didn't mean to cry.